News, Nairobi.
Now, the Ethics and Anti-Corruption Commission has begun a system review of the National Hospital Insurance Fund. The 45-day exercise will see the commission examine the work systems, policies, procedures and practices at the NHIF. The move comes 2 days after the cabinet approved 3 bills seeking to repeal the NHIF and replace it with 3 health provision funds.
The EACC has carried out systems reviews in other units in the health sector, among them the Kenyatta National Hospital, the Kenya Medical Professional and Dentists Council, the pricing of pharmaceutical and non-pharmaceutical products, and the universal health coverage. The commission is taking the next round of reviews to the NHIF.
For the fund, we know it is a critical agency in ensuring that Kenyans are able to access healthcare. So the work that we'll do here will support the fund to strengthen its systems of accountability and transparency and governance generally.
Do we have gaps? Are there areas where we have gaps that would help us prevent corruption and develop more policies, improve on the policies that we have? Are systems robust enough to prevent corruption? So that's why they are here.
The NHIF has been ailing for a while from the alleged 1.5 billion shilling scam involving the procurement of a revenue management system in 2018, the row over the reimbursement of funds between the fund and private hospitals, to claims of illegal payments to hospitals.
Prevention is better than cure. If we are able to identify where the challenges are, if the institution is committed to reforming those systems, we have seen turnaround in service delivery, in performance, and even in corruption reduction.
There will be a report after the 45 days, and again after those 45 days they are going to help us walk through, not just a report that is going to be given. We'll be involved with them in walking through to see that we carry out the implementation.
The NHIF was set to drive the universal healthcare policy, but the government is mooting for some changes. The cabinet has approved 3 bills that seek to repeal the NHIF and replace it with 3 funds: the Primary Healthcare Fund, Social Health Insurance Fund, and the Emergency and Critical Illness Fund.
The prevention system was not strong enough, and that now you see there is a Primary Healthcare Fund, Social Health Insurance, which is compulsory, and then the recognition that we have critical illnesses that are draining the resources from NHIF and from the fund, and therefore the government has decided that they are going to set up a critical illness fund that will not be eating into this social health fund.
The 3 bills are set to be presented before Parliament for approval. Rita Tinina, KTN News.
Thanks, Rita, for that.